Hey, good morning, everybody. I am here because I want to talk about shoulder injuries. Now, I hurt my rotator cuff quite a while back, maybe about a year and a half, if not 2 years. I've done physical therapy and the work that I do for my job as a massage therapist, it never healed. I just kept making the matters worse. And so I've been going to a therapist again. Now, I'm icing it right now. I could probably stop because it's been on long enough. This is actually an ice pack for the hip, and it works wonderful for the shoulder as well. What I was having problems with, I could not reach my arm behind me. It hurt to do this, right? And for a woman having to put your bra on or do things, it was really frustrating. But I was doing physical therapy and I actually started going to the gym as well and using the equipment to work it. And yesterday when I went to the physical therapist, I took my jacket off and I did that and I thought, oh, I didn't have pain. There's hope for everybody. I just want to tell you that. It's not always about getting shoulder surgery. A lot of times doctors get excited about that because of course it's extra money for them. But if you don't need it, don't get it done. Physical therapy and working those muscles will strengthen that shoulder area again. I'm telling you, save your money if you can help it. Of course, if you get an MRI done and there's fibers that are torn and it's in pretty rough shape, then definitely consider surgery. But just because you're having shoulder pains does not mean you need surgery. You need to work it. The muscle is weak. You probably did something and you've been babying one part of it. It needs a fine balance between them. That's what we've been working. We've been working on getting those muscles strengthened. That's pretty much all I wanted to tell you guys, is don't always think that it's a surgery. And I know there's a lot of you that probably are even just avoiding going to a doctor because you're thinking you need surgery. And so you just eat it, right? And you suffer. But if even in that case, it doesn't hurt just to visit a physical therapist. Get it done. I'm sure there's a lot of us who are not utilizing our medical benefits. And those who don't, well, I would say start picking up a little bit of weights and maybe going on YouTube and looking for exercises. And if you are working on exercising that shoulder and you realize that you are seeing an improvement, you probably never did need surgery. And it just all boiled down to you strengthening that rotator, all those rotators, right? We've got the supraspinatus, we got the levator, we've got the rhomboids in a way that are connecting to that back scapula, the trapezius, the infraspinatus, which is right on the shoulder blade and is just a tough doozy. We've got all of these up and through here that could be responsible. And just because you're feeling a pain in one spot doesn't mean that's where the actual injury is occurring. Anyway, that's all I wanted to tell you. Don't always think that it's surgery because I'm able to do this without pain now. And I am super elated. And it just goes to show that the exercise and the physical therapy and strengthening, the strength training is working that shoulder back to good health. There you have it, everybody. You enjoy your Sunday. Peace out. And within my friends, bye-bye.